So essential thrombocythemia is a disease that has several unmet needs. And right now we focus on identifying patients who are at higher risk of having a thrombotic event and then lowering their platelet counts. In addition to identifying patients with symptoms that may benefit from cytoreduction as well. But really it's all hinged on this thrombosis risk. Because to the best of our knowledge, there are no medications or therapies outside of bone marrow transplant that can cure patients or potentially extend their survival. There is some suggestion that interferons may do that to some degree. There are data on myelofibrosis-free survival improvements with interferons, but I think that's still an area of active investigation. And I think what we really want for these patients is something that can deeply affect the disease and not only reduce the risk of thrombosis, but also lengthen survival.